It changes your life forever.
I actually was diagnosed 2 months prior to retirement.
I just had lost my mother to ovarian cancer, so I was very concerned about where it might lead.
It felt like you'd just been hit with a brick. I thought, it's not real, but it was.
We had our mind made up to deal with it.
The nurses at the cancer clinic were phenomenal. They were truly compassionate and very friendly.
Building Hope is why King's Daughters earned accreditation from the American College of Surgeons Commission of Cancer. Building Hope is why the Cancer Center oncology nurses challenged themselves to become oncology certified nurses. Today, our oncology department celebrates 25 years of service. Building Hope is why King's Daughters is building a new cancer treatment center. Welcome to the Hope and Healing Campaign. King's Daughters Health, quality care, close to home. Every year, cancer affects millions of Americans and hundreds of people in our local community. In 2012 alone, the CTC did 2,120 radiation procedures, as well as 10,047 medical oncology procedures. As our community ages, those numbers will only increase. Cancer knows no boundaries. It affects mothers, brothers, fathers, sisters, grandparents, and children. Cancer impacts entire families and often takes a physical, emotional, and financial toll on everyone involved. Cancer disregards gender, age, and status. It takes survivors through a difficult and challenging journey. Building hope and healing for cancer patients requires resources. It requires access to exceptional care when and where it's needed. It takes a commitment from area businesses, foundations, individuals, and organizations. It takes all of us working together. That is the challenge and the hope for the new King's Daughters Health Cancer Treatment Center.
People are diagnosed with cancer, it's overwhelming for them and for their family and for their friends as well. And to have a cancer center in our community allows people the opportunity to have hope and healing because they eliminate the stress of transportation, of trying to maneuver their family life, and in the extra gift of time because they can get that treatment at home.
Our community has a clear need for a new cancer treatment center. The physical separation from the hospital makes it difficult to maintain the current facility's operations, and expansion or renovation of the current facility at its present location is simply impossible.
We definitely need to be close to the hospital for a lot of different reasons. We have people that go for x-rays, lab tests that we can't do in our office, and then people who are getting radiation have to have that trip daily. It's a daily Monday through Friday treatment, and if they're in the hospital, they have to be brought down by ambulance.
Ideally, the new cancer treatment center would have been built at the same time as the new hospital, but it was not on the recommendation of KDH's financial consultants, Piper Jaffray.
It was determined through all those discussions and analysis and research that was done that from a financial standpoint, it just wasn't possible to do the cancer center, although it would have been nice.
Today, connecting the new cancer treatment center to the hospital is the most productive and cost-effective solution. The managing board approved the new center in 2011. The goal of the planning process is to have a facility that meets the current and future needs of patients and staff for years to come.
A lot of thought went into the planning of the new cancer center as far as location, making it more accessible and easy for the patient to get to where they're going, allowing staff to have more flexibility so that they can work with each other and accommodate patients' needs better. The team meets on a very routine basis with the architects and the designers to try to plan every little detail so the patient knows that we have looked at everything that they're going to have to do from the time they walk into the door until the time they leave.
It was determined that the best placement for the new cancer treatment center would be connected onto the hospital's easternmost side. The center will be a one-story building with a covered entrance allowing easy access. The building triples in size from the existing facility, increasing from 5,000 to 16,300 square feet. All exam rooms are a short distance from the lobby, limiting the distance a patient needs to walk. The new infusion area will have 7 bays and 2 private infusion rooms. Each of the 7 bays can accommodate a guest seat. 6 exam rooms will be conveniently located for easy patient and staff access. The radiation area will feature a state-of-the-art vault to shield the center's occupants from radiation originating from treatments. The new linear accelerator will be a variant with RapidArc and dual energy capacity. RapidArc technology is a major advance that improves dose conformity while significantly shortening treatment times by delivering treatments 2 to 8 times faster than other treatments available today. It enables physicians to improve the standard of treatment and care, ultimately allowing KDH to treat patients it once had to refer to other cancer centers. This allows patients formerly referred elsewhere to receive treatment locally. In addition, the center will have its own CT scanner that will eliminate any need to transport a patient for a radiation setup.
To be able to have the highest quality of cancer specialists to come to our hospital and having the kind of equipment that they can use and benefit from and provide the kind of care they want to our local patients is extremely important.
Recently, the KDH Cancer Treatment Center affiliated with the Norton Cancer Institute. The affiliation provides patients with access to experienced cancer physicians, as well as additional research and treatment protocols. For the affiliation to flourish, an improved facility containing technologically current equipment and resources is essential.
Working in conjunction with our partners at Norton Healthcare and our national partners with the National Cancer Institute, there's real benefit of building the cancer program here locally. So many things can be done right here in Jefferson County, in Madison. And using national standards and implementing them here, this is something that a community can really rally around.
Once completed, the new Cancer Treatment Center will be a tremendous healthcare asset to our area, providing many benefits, including not having to leave town for almost all treatment procedures, less time away from a job for a caregiver, and saving employers money, increased clinical stature of our program, ability to expand and have access to services not typically found in a rural location, like survivorship program, palliative care, and clinical research, innovative technology and equipment for specialized treatments, and access to oncology provider specialists for breast, brain, behavioral, and other oncology specialties. A dual energy linear accelerator with RapidArc technology, reducing treatment times, and improved patient experience and privacy. Throughout the past century, our community has generously supported King's Daughters Health, including the first building to be a hospital was generously donated by Mrs. Drusilla Lanier Cravens in 1899, a new building for the second hospital in 1915, a wing addition in 1959, 40 new beds, a recovery room, and an X-ray suite in 1966, and 36 new beds and 5 ICU beds in 1970. In 2005, the King's Daughters Hospital Foundation was founded to assist King's Daughters Health in its mission to improve the health of our local communities by supporting healthy initiatives, raising awareness of localized needs, and supporting innovative solutions to those needs. Now the foundation is leading the Hope and Healing campaign. The cost of the new King's Daughters Health Cancer Treatment Center is $11 million. The effort begins with a commitment of over $7 million from King's Daughters Health, leaving a campaign goal of $4 million. Now the rest is up to us. Since 1988, King's Daughters Health has provided care, support, and hope for cancer patients. It is amazing what hope can do. A gift to the Hope and Healing campaign goes to a program that will provide hope, comfort, and community to those whose future seems bleakest.
Please support our campaign for the new Cancer Center.
It will create jobs for the community, and most importantly, it will take care of our patients who need it the most.
Please give to the Cancer Treatment Center. All of this area is like one big family.
the community bands together, and this is one time I'm hoping that our community will band together and give for such a worthy cause.
Gifts can be pledged over a 3 to 5 year period. Gifts of cash or other convertible items are welcome. Also, donating depreciated or appreciated stock is another way to join the campaign. Investing in the King's Daughters Health Cancer Treatment Center is investing into our community's future. Help us continue to build hope and healing, one day at a time, one life at a time. We are making a difference.